So I'm a periodontist, a specialist in the gum and bone and infectious diseases in the mouth. I've been practicing for about 10 years now. And during the beginning of the pandemic, uh, when all of the news, every day there's an article being published, everyone's just searching to try to find out what's going on, how it relates to their own field and what they know. Um, we heard the word IL-6, cytokine storm, and I deal with a lot of cytokines in the mouth and the gums due to bacteria and microorganisms in the mouth. So my research partner and I, we went into the articles and we really went in depth to read all the old literature, and we definitely found a connection. And it was a pretty strong connection between what goes on in the mouth and COVID severity. So that's where we went in and wrote this article, a pretty lengthy analysis, and basically it's a review paper that connects the dots showing how this bacteria or virus or any intruder in the body that really occurs, and how our gums relates to it. And so I'm excited to talk about it today.
And I want to get in depth on the science of that, but hearing about your background and hearing before we started really getting into things, you were saying how you do deal with infections yourself on a daily basis. We don't often have, dental surgeons, periodontists, dentists on when we're talking infectious diseases, and that flows from some of the way these specializations are formed and the way things get balkanized and siloed. Um, can you tell me a bit about that wall? Like you said, you hear these terms that are your bread and butter at times.
Yeah. So I believe there is a big problem in healthcare. And this problem is that the dentists, we go to dental school for 4 years. If we go on and specialize, it could be 2 to 4 years or 6 years after. The medical doctors, they will go to medical school for 4 years and go on another pathway. So you have completely two different avenues. And there's very little overlap that these two have as far as a common ground. So for example, when you see a CT scan and you see a dental implant as a medical doctor, you know, do you really have full comprehension of what that is and what the ramifications of that are, and if there's infection around it, and likewise the dentist. So I feel that there needs to be more of a collaboration. Uh, Medical doctors, one of my missions is actually to educate and explain that there is this connection that medical doctors need to look into the mouths more, and particularly the gums. And not only just look, but with a cheap tool that's called a periodontal probe, and actually go around, certain teeth, especially in the back. That's where we usually have the main problems. The more back you go, the more chances of infections, because you have molars, you have bigger teeth, more surface area, more roots. Also, you have more important organs in the back, and more nerves and sinuses, and so this infection could spread. I remove infections in people's posterior mandible, and they had ringing of the ears, and the ringing is gone, or migraines and headaches from behind the last tooth. I just took out infection on an implant. Right behind it, there was a large infection. Remember, she had no idea she had it. She came in for dental implants somewhere else. She said, but I have no pain. And only 6% of gum infections cause pain. That means most people don't even know they have this in their mouth. There's not much nerve endings in the jawbone, just like how someone could have cancer of the bone and spread. People don't know often that they have these things in their mouth. So there needs to be more of this collaboration, I agree.
Well, and that, to your point, it sort of brings to my mind that separation in some ways impacts what we considered when we had initial social distancing guidelines, things of that, what would and wouldn't be sort of essential in-person care, in the sense that I can imagine some of these, you have a lot of people who haven't been to the dentist in the past 6 months, the past longer than that, it's going to be coming up upon. Are you seeing people start to come back and there's bigger problems than we would have had with that? And then, I mean, then you break into the ethics of that when you think about if this is related to worsening COVID-19 severity.
Yeah. During this pandemic, there were a lot of patients that stayed away from the dental office, righteously so. You know, the aerosol that is created by a dentist could be a problem. The hygienist cleaning with the ultrasonic could be a problem. Now, they haven't shown in this past 8 months or so that there has been any kind of cross-infection or any dentist giving it or getting it, or any staff even. So that's really good. And so patients now are coming in. Many people need to be on a cleaning maintenance every 3 months. So the number 6 months comes from the insurance companies because that's what makes financially sense for them. But really, the elderly, especially once you get some bone loss, you need it to be 3 months, maybe 4 months. Imagine this pandemic, most people haven't gotten a cleaning this whole year. So I've been seeing a lot of people with bloody gums. It may not just, you may not look in their mouth and it's bleeding, but if you, again, you need a probe and you'll go in a little bit and come out and blood will start, hemorrhaging out. So yeah, I think, and that leads to bone loss because that's the initial gum inflammation is called gingivitis. That's the first stage. When that stays there for a while, those cytokines, the toxins, the bacteria release, the LPS and the others, those are what break down collagen and break down bone and cause the bacteria. But even more importantly, the toxins go into our bloodstream and spread, causing inflammation everywhere.
So that seems like a bridge into the details of the paper. If you could explain in a bit more fine detail what the connection with the cytokine storm is, because that's a term we hear a lot when we're covering COVID-19. I don't think of, gum infections, right? But then this is a place where it's actually quite important.
Yes.
So can you bridge us from this to that and to the role of IL-6? I mean, there's and also too, we'll get into how much of this is speculative and how much can we do further research on and potentially learn, with a patient population.
Yeah. So as we know right now, for the past decade or so, the gut has been a really big hot topic of focus as far as bacteria, as far as how it affects the whole body. I believe that the oral care, the mouth, the saliva, everything that goes on in the mouth is equally as important. It's the first entrance into the body. And we have so many, we have 700 different species of bacteria that there could be in the mouth, viruses, funguses, mold, everything. Every microorganism that you can imagine is in the mouth. People are mouth breathing, they have deviated septums, they can't breathe with their nose well, they have to open up their mouth at night, their mouth goes dry. The saliva is a buffer for the pH. The more acidity you have, the more bacteria that feed off of that and grow and cause a dysbiosis in the mouth. And when the bacteria, you have two different types of really bacteria in the mouth. You have the anaerobic bacteria and you have the aerobic bacteria. The aerobic bacteria are what mainly cause the cavities, like strep mutans. And then you have the anaerobic bacteria, like Prevotella media, you have Tannerella furcinthes, you have AA, P. gingivalis. These bacteria, they're strong, they could survive without oxygen. They go into, and they have weapons. They have the LPS. They have these weapons that can break down and create an entrance and leak into our bloodstream. And when they do, they release our body's immune system. In response to that is we send the first phase, stage where the macrophages come in and the neutrophils come in. And so they see this intruder, the toxins and the bacteria, and they sound the alarms to the rest of the body, sounding the alarms in the form of releasing cytokines locally, okay? These cytokines then, such as IL-1 beta, TNF alpha, IL-6, IL-1, almost every IL you could think of, but IL-6 is the really the bad one, especially with COVID. The IL-6 gets released locally, goes through the bloodstream because it seeps through the gums. And remember, the blood that flows through our mouth, through our gums, through our bone, is the same blood that flows through every organ and down to our foot in 1 minute. 1 minute is all it takes to get to the bottom. So your heart is pumping, 60 beats per minute, let's say, and that thing is just making this bacteria go all around. So that's the connection. That's how everything comes together. And now when this IL-6 gets released, swims it around in our blood cells, our endothelial cells now inside our blood vessels now see an IL-6, and then they release IL-6 as well. So it's like a town where you don't have a cell phone and there's an intruder, and the way to spread the word that someone's there is releasing IL-6 and cytokines. So it's a cascade really of a release throughout the body. So everyone's like IL-6, everyone's sending it so everyone else knows. And so now you have an increase in this inflammation going on. And not to mention there's different pathways, which I may get into a little bit more later, where we talk about inhaling bacteria, swallowing saliva. And so this IL-6 is really the key because a study in Germany very early on, and this is the study that really made me come up with this thought and this connection, is the study was brilliantly done, very simple in Germany. They took one group of people in the hospital, and they basically checked when they got COVID, and they checked everything in their blood before, all of the different markers, inflammatory markers, their blood cells, everything. And then they checked them as they were going down a bad path and needing a respirator and ventilator. And they saw that there is really two key differences in these two types of people, and how you almost, basically I can say how one dies from COVID. And that is because their IL-6 levels went above 80 picograms per milliliter. They said that that's a predictor for people being put on a ventilator. Also, CRP levels, were shown to be very high in these individuals. So what the IL-6 and CRP are things that when we do cleanings, even basic deep cleanings, we can lower those two. And so there's studies that show that we could reduce just by doing a deep cleaning on someone that has gum disease. And remember, chronic periodontitis, gum disease, advanced gum disease, bone loss, these are mainly on elderly people. Those are mainly the people that are going to the hospital. Those are mainly the people that haven't had a cleaning in a while. These are mainly the people that had maybe this silent thing going on in their mouth. It wasn't getting checked. People are scared of it going to the dentist in general. You don't know how many times a day a patient says to me, "I'm so scared. I'm good with everything else. It's just something about that needle in my mouth." And they're this, buff, bodybuilder. The older ladies, they come 90 pounds and you can do whatever you want and they're fine. But, people have a fear of going to the dentist, and it's known. So with 80% of people having some form of gum disease, it used to be 75, now it's 80%. This is a pretty big problem that is being overlooked. And if we were able to assess and look at the mouth a little bit more, we can help these people by doing, referring to a dentist, a hygienist, phase one. That's for sure. You have to have your cleaning, has to be deep. You may need numbing with your cleaning. Dentists aren't the best people to clean teeth either. You have to go to a hygienist, unfortunately. Dentists, they don't have the time. Their business model is not meant to clean teeth. So these are realities that I want to talk about. It needs to be talked about. We need to get towards a point where we're helping out people and patients around the world.